This video has been produced by the East of England Ambulance Service. The aim of this video is to introduce the adoption of the Cuddle Pocket for stillborn and miscarried babies, and to briefly touch upon stillborn and neonatal bereavement. This video is aimed at all frontline staff that would attend maternity related calls. There have been several reported incidences of stillborn and miscarried babies that have been transported in an inconsistent manner. And when we've looked into these concerns, it's become apparent that these types of calls are really distressing for not just the families, but for the clinicians involved. We've therefore looked for a solution that will allow the safe transportation of these babies in a compassionate and dignified way.
The Cuddle Pocket is a knitted pouch for the compassionate conveyance of stillborn preterm babies.
We named the pockets after Cuddles UK. They are a non-profit organisation who coordinate knitters across the UK to make items for preterm babies. Cuddles are providing the Trust with 600 pockets free of charge. There will be one on every DSA, LOM and Heart vehicle. Pockets are single use and they will be located within each vehicle where the maternity pack and the maternity action cards can be found. The pockets are designed for babies that are less than 24 weeks in gestation. Each pocket is unique, individual and handmade.
So the death of a baby can have a profound and stressful impact on both the families and the staff who've been caring for them during that time. But healthcare professionals can have a really positive influence on how parents and families experience their care, even if their babies die. So it's really important that you consider how you're communicating with them. Consider the setting where you talk to families. If it's possible to have a private room that's quiet and comfortable, then try and make that happen. Make sure you introduce yourself. Hello, my name is. That goes a really long way to making the families feel comfortable during this time. Ask the families if their baby has a name and use that name. It will really help bring comfort to the families during the time afterwards as they go through their grieving process. Ask the parents if they have a preference, whether they would like to be called by their first names or whether they'd like to be referred to as mum and dad. And don't be afraid to ask these questions. It's all part of helping them to acknowledge the fact that they have had a baby, even if the outcome hasn't been what they wanted. Make sure you speak kindly and gently and convey compassion to them at all times. Sit down with them, make eye contact, and do not rush. Express that you understand the situation, the enormity of what they're going through, and that you have sympathy and regret for what they are experiencing at the moment. But it's also really important that you communicate clearly with them. Make sure you take time to gather your own thoughts and be well informed about all the options available, and there will be some resources posted at the end of this video. Make sure you avoid using too much medical terminology, but do be really clear and direct about what's happened to them. If their baby has died, make sure you tell them that so that they understand that this is what has happened. Make sure that the parents understand what's happened and what is going to be happening to them next. Be really clear about those next steps. And most importantly, make sure you listen carefully. Listen to what they say and try and answer any questions clearly and honestly. It's also really important that you have some self-care after an incident like this. It can be really distressing for you as a medical professional involved in something where actually the outcome hasn't been what anyone would have wanted. There are many charities who can help support you during that process. The charity SANS is there for medical professionals and all health professionals, not just for parents and families who've experienced loss. If you do feel like you need extra support following caring for a family after the loss of a baby, then do make sure you seek it, either through your line manager, if you feel comfortable to do so, your occupational health department, or go to the NHS website who can signpost you to a number of charities and organisations to help you through this process.
We understand these types of incidents can be extremely distressing for all concerned. We would urge you to contact your line manager, speak to your colleagues, or contact the wellbeing services if you're affected by any of this. And please take care of yourselves.